the slides are, I would like to ask the same question that was displayed. Everyone was telling yes, right? But actually when I see someone abandoned in road, I don't see any car stopping. Do you see? No. So these are very deep reflective questions. That's why I had intentionally put it before the program starts, so that it fits in your mind. Next time when you see someone abandoned on the road, maximum of them are psychiatric patients. It's a sad but reality. The second question would be, would you employ someone with schizophrenia at your clinic or as your driver or in your house? Would you, sir? It's a difficult question. The third question is, suppose you are in a relationship with someone and then one fine day you get a prescription from their bag. He or he is diagnosed with schizophrenia. Would you continue the relationship? How many? So these questions are easier said than done. So these are the three questions that you need to go and think at your home. Okay, so let's start with this year's theme is very interesting. Okay, so first question, I know everybody who told yes. Today if while going home, you saw someone, you will feel, "Arey bade dogi, wallet dogi, count dogi." These things do come to our mind. Even a psychiatrist, they come to our mind also. So these are the rules. The second question is, would you give a job? I don't think anyone would employ a person having mental illness. Would you? Anyone is interested in employing someone with a mental illness? Obviously no. And then the relationship thing. So many relationships, so many young patients, good people doing MBBS, doing engineering, they come that my partner has schizophrenia, what do I do? Do I continue the relationship or not? And it's a difficult question for a psychiatrist to answer. So there are certain myths and there are certain realities. The first thing is that when we think of schizophrenia, we think the patients are valid. Yes, they are valid. But remember, very few of them are valid. Mostly schizophrenia patients are the victims rather than the perpetrators. Any disturbance? Should we continue? Okay. Again, sir has told about split personality, split mind, as shown in a lot of movies, but it is not exactly right. It is a brain disorder, of course it affects the thinking, emotions, behavior, but it is not a split mind. And remember, the person is not always disconnected from reality. Only when he is in the illness stage, then he is disconnected from reality. The biggest myth, schizophrenia is untreatable. Sir, madam, families will come and then tell you, I have worked all over India. I have worked in asylums, all kind of settings, medical colleges, PHS. You won't believe how many patients, while I was working in CIP, how many patients are abandoned by their families. That you keep the patient, you don't keep the patient at home. Why? Because of the myth that it is untreatable. No, it is not untreatable. The patients do recover and live fulfilling lives. We will see many examples now of what kind of lives they can live. Again, the unemployment, this is the biggest problem. After they are treated, after they come back from asylums, from mental hospitals, their life is never the same. No one sees them as the same, neither their family, neither the society. And finding a job, just forget about it. So what is schizophrenia? I won't go much into details, but it is a mental disorder affecting how a person thinks, feels and behaves. The common symptoms are delusions, hallucinations, disorganized speech, impaired functioning, and you can see how high is the prevalence, 1 in 300, and it is often misunderstood as stigmatized. These are the symptoms, the positive symptoms, negative symptoms, cognitive symptoms and affective symptoms. These are the 4 pillars of symptoms that people have. The patients often come to us when they have positive symptoms like hallucination, delusions, disorganized thinking. But when a patient is having negative symptoms since long, nobody brings them to the hospital, like reduced emotional expression, lack of motivation, social withdrawal, and also the cognitive and affective symptoms like poor memory, difficulty concentration, anxiety, depression, mood swings. and the depression and this phase is very common in schizophrenia patients. We often tend to mislook it. So rethinking the level. Why do we really need to rethink the level? Because the levels lead to stigma, shame, and isolation. Are schizophrenia patient. When we go into society, schizophrenia patient. This happens or not? Have you? It's interactive. You cannot tell. It happens or not? Yes, ma'am. It happens a lot. Especially if it's a female, her life is hell after that. Okay, so that leveling. When you say schizophrenia, no, don't tell that. It's a person with schizophrenia. It's a condition that comes and goes. It is not his full identity. Mental illness does not define identity. So rethinking the level is about promoting awareness, compassion, understanding in the communities. Reclaiming the story, empowering the voices of those with lived experience. Once we level a person with schizophrenia, we do not listen to them. What is their life? What is their experience? So we have to support recovery-focused care and peer-led programs. We have to celebrate the resilience and creativity of individuals living with schizophrenia. I personally know so many of my patients doing so well in life, sometimes even better than us, and advocate for the rights, dignity, and inclusive support system. So we'll see some of the very success stories that will give us a hope that patients with schizophrenia can do extremely well. This one, A Beautiful Mind, sir has already told. He's a Nobel Prize winner, John Paul's. He's a mathematician, Nobel Prize in economics, diagnosed, and then he had extensive periods of hospitalization, and then returned to his academic work. His life inspired the movie. If you haven't yet watched A Beautiful Mind, please go and watch it today. It's a must watch. She is Ellen Sachs, professor of law, psychology, and psychiatry. The author of the very famous book Center Cannot Hold. Whoever are interested in book reading, please read this book, Center Cannot Hold. Her schizophrenia journey was diagnosed with chronic schizophrenia. She had a very bad prognosis, but then she defied it and led to a very successful academic career, and also she is a very prominent mental health advocate. Everybody must be knowing him. Who doesn't know Van Gogh? The paintings, the big museums in Paris, in all the Netflix series, Van Gogh paintings are shown, their museums are shown. So he created over 2,000 artworks. And historians say it's not clear whether he had schizophrenia or bipolar, but he had mental illness, he was abandoned, he was homeless, he was on roads, but still see the world. When we talk of art, Van Gogh is never present. So she is Dorothea Bucks, a sculptor and a writer, and she is advocate for psychiatric reform in Germany. She was diagnosed at 19 and also survived the post-sterilization under Nazi regime. And she co-founded the dialogue movement to promote dialogue between patients, families, and professionals. Anyone? Sid Barrett fan? Any music fans in the audience? So the very, very popular member of the group known as Pink Floyd, and he pioneered the psychedelic rock and Pink Floyd albums. Please go and Google Pink Floyd albums. You find very interesting tracks over there. And he left the band due to mental health issues, and then after returned back. And even today, musicians are inspired by his work. So the 8 you left wanted to. Anyone knowing the Beach Boys? Nobody is interested in music? Audience? So he was the co-founder of Beach Boys. And he created very groundbreaking albums after being diagnosed with schizoaffective disorder and battling substance abuse. The point here is people from different walks of life. He was a very famous player, an NFL player in Green Bay Packers. So this person, after his schizophrenia, he performed very well and one of the famous players. Then coming to the psychologist Frederick Rees, he was diagnosed while he was serving the US Marine Corps and became an advocate for mental health. So the point is, despite schizophrenia, despite the illness, people can have a very strong academic career and a good life. But have you all wondered why all the foreigners are on the... anyone wondered why no Indians? Because to have this kind of career and life after schizophrenia, you need that kind of support system, that kind of environment. which unfortunately our country is lacking right now. But we hope in future you all will promote the awareness, and we will have a society that our people, even after getting diagnosed with illness, they will have this kind of life. While I was searching for Indians, I could not get much, except for Parveen Bhavi, and but then you know how sad their life was. So India is not yet ready to let the patients live with full dignity and right. I'm so sorry to say. So what can we do? We can educate ourselves and others about schizophrenia. We can challenge the stigma and stereotypes in the daily conversations. Even other department people, I say, when there is a psychiatric patient, थोड़ा सा stigma वहीं शुरू हो जाता है. ये psychiatric patient happens or not? Psychiatric patient that happens. So we have to change it here. We have to change the stigma starting from here. Encourage the conversations that promote empathy and support access to mental health resources. Not everyone is lucky to have the resources. You won't believe certain patients come, they haven't consulted a psychiatrist for 10 years, 15 years. Because the boom of psychiatry happened now, they could not get the access since now. So we have to join the movement, challenge the media stereotypes, particularly what has been portrayed in the movies. After seeing Kerala movie, people were scared of mental asylums. And I would say from my experience of working 5-6 years in central psychiatry, no place is beautiful than an asylum. But people are scared of it because of movies like that. So rethink the level and reclaim the story. Shift from labeling people to recognizing their experiences. Replace the word schizophrenic with persons living with schizophrenia. And let's celebrate the stories of resilience, not just the symptoms. And include people with resilience in the conversation. Promote dignity, respect, and identity beyond the diagnosis. This is the summary. The call to action is, again, educate yourself, challenge the stigma, listen without judgment, support inclusive mental health policies, and show compassion. It is easier said, but it is difficult to do.